Thomas, I am doing physical therapy for my facial paralysis, and my physical therapist told me to do Botox, which is very important. Doctor prefers focusing on aesthetic aspects rather than using Botox for paralysis treatment. I'm afraid of getting worse after Botox. What's up? So, guys, Botox doesn't make your face stiff like people think. Rather, it actually makes your face soft by weakening the muscles, reducing movement, and creating a smoother appearance. When a patient desires to minimize the visible signs of aging like wrinkles, they opt for Botox treatment. This procedure involves injecting specific areas to inhibit muscle movement, resulting in reduced expression lines. For example, the crow's feet here in the corner of the eyes, the forehead not to raise. In cases of facial paralysis, the treatment goal varies. We want to reduce some movements so that one side of the face becomes more symmetrical to the other. So it is done by a different professional, a professional who is specialized in the application of Botox in cases of facial paralysis because the points are not the same. What's your recommendation for proceeding with this procedure? Find someone who has already performed this procedure for patients with paralysis and who understands a bit of the physiopathology of facial paralysis because this way you will have a better outcome. This procedure can be performed during rehabilitation to decrease some movements, decrease kinesia so that the patient can even do physical therapy more effectively, and also after complete recovery, that is, after the phase in which the patient has to regain movements, he is left with some sequelae, some extra movement or some movement that is not performed. Then he does Botox so that the face becomes more symmetrical, that is, in the earliest phase to help in rehabilitation, and in the later phase to decrease the sequelae over time. If you want to learn more about Botox for facial paralysis, like the video and subscribe to our channel.